And I will invite the other speakers from this session to the stage. So please find a chair. I hope there is room for everyone. And we also have a online attendance. Yes, that's good. Great. I don't know if that we have taken a little bit of the time here, so maybe I should go directly to the questions from the audience, and then we can go back to some of the more general questions maybe later. Is there anyone in the physical audience who have questions for the panel? Yes, there is a question there, and just wait for the microphone so everyone, also the online audience, can hear it, and then I will also, there's a lot of questions from the online people too. Yes.
Okay, thank you very much. My name is Joëlle Nielsen. I'm independent consultant, but I've worked for the Danish Ministry of Environment and from the European Commission and also for an NGO. My question is that I think it's mostly directed to Joëlle. Of course, it's interesting and it's sad to hear that you have epidemiologic studies that shows you that mixtures matters, because I mean, we have started working on mixtures many years ago, and already back in 2009, there was council conclusions on combination effects of chemicals under the Swedish presidency. And since that time, we have had a lot of research on mixtures. There's been a lot of policy initiatives and so on. And as Paul Speight also mentioned, that the chemical strategy for sustainability back from 2020 mentions that we need to introduce a mixture assessment factor. We know that industry is quite hesitant to do this, and there has been a lot of different research on the number of the mixture assessment factor. So could you, I know we must face that it is impossible to test all different sorts of mixtures, so we need this pragmatic factor. So do you have an indication? I know it's difficult to say, but can you give an indication of what you feel from a scientific point of view would be an adequate number of this mixture assessment factor? Thank you.
Thank you, Pia. So also within this project, we actually try to do an exercise like this, and of course, one can say that it really varies for the chemicals, and of course, we also have to say that this is still then based on the knowledge we have now, and I think what we have certainly learned from not only the mixture problematic, but the whole chemical regulation, I think, is that we are rarely too careful. So I think if we want to be really pragmatic and not kind of spend more time on, delineating what would be scientifically a very reasonable assessment factor, I would say let's start with 10. As we are used to that, we do that all the time. We use 10 for many other things, and certainly not less than that.
Thank you. And there's an online question. Josephine Frame, she asked, for the transition of PFAS in breastfeeding, is there any data comparing the PFAS exposure rates for babies who are exclusively formula fed, and what is their exposure from their food source in plastic bottles, etc.? Is there anyone who can answer this? Yes?
I don't think we can answer, but I don't think PFAS is that much in bottles. So if the longer you're fully breastfeed or exclusively breastfed, the higher. So I think we can say that. But again, it's also good to breastfeed, and I can remember we talked about your daughter and how to. I think your talk was so good because it just shows us that there is no way we can actually advise exposed people, because I didn't know. The only thing I said to you at that time was, I think if I was your daughter, I probably wouldn't breastfeed because you were so high exposed, and you would put it and pass it on to the next generation. But I mean, this is just my feeling. There's no studies, because maybe also the transfer is higher if you're high exposed than if you're low exposed. So, but I think definitely we see that exclusively breastfeeding is a higher transfer rate than partly.
Thank you. Yes, there's a question here.
Thank you very much, all of you, for a very nice presentation. My name is Anders Juhl, and I'm one of the organizers of the big conference and of this meeting. I would like to put forward a big thank you to you, Kenneth. I think it's very brave that you have presented your story, and that moves everybody, I think. I also have, so thank you very much. I think I would like to also ask you, because you're outspoken spokesman for an entire community, and I was just, how do all the people there that are not spokesmen, have they reacted to this? I mean, are they equally concerned and emotional like your story?
Yes, they are. Yes, they are. They are very emotional about it, but the main thing is they feel they feel it's a shame. They feel I don't know why, but they feel it's ashamed about having this. We didn't know that each time we had a steak, we ate a lot of PFAS. We didn't know anything about this, and every time a reporter calls me, says, "We have talked with you 100 times. Can we talk to anyone else?" I reach out, and nobody wants to talk about this. They feel ashamed about being exposed of this, and they know what they might have given to their children. So it's something people don't want to talk about, unfortunately, except me.
Except you.
Can I also add, can you please correct me, but Anne Lyngberg, she did a lot, and she phoned me saying, "You know about PFAS, what can I advise these people?" And I said, I wouldn't know, but also Anne, she took all of you in for a clinical examination and offered a psychology consultation if they want to talk to a psychologist. Isn't that right? You were all offered that, and was interesting, and that's how life is, isn't it? That the people who were most scared was not the highest exposed. The people who were most scared was probably some of the ones that shouldn't be so scared. But this is this risk communication. It's so hard to communicate risk, because once you say cancer, they all thought they were going to have cancer. And it took, we had a meeting in Korsør with lunch and everything, and we tried to explain to them. I said to them, listen to me, in Rønneby, people were much higher exposed, and there hasn't been that many deceased people. So please take it easy. But it is really hard to communicate and relative risk and then to the individual risk. That's so hard.
Paulina?
Yes, thank you. So Paulina Damdimapuro from Karolinska Institute, and my question is for the online panelists. I think, Paul Speight, you said in the beginning of your talk that you recently met with the industry representatives and NGOs to discuss the upcoming REACH revision and CLP regulation. And I was wondering, should you not include scientists in those discussions as well to have a bit more balanced view of the problem? Why is it always the industry that gets to be there to discuss this and not scientists, the representatives of the public health?
Oui. Want to answer that?
Yeah, sure, with pleasure. Look, so there are different types of meetings. We obviously meet a lot of scientists as well. I mean, I regularly come, I'm here only virtually with you, but I regularly also go to conferences, and we regularly meet a lot of scientists. In our Caracal, which is the lower level, there are people from like HEAL, for example, which is people who are concerned about healthcare. So it's an NGO, and there are a lot of scientists who are involved with that. And so we do hear from that. Of course, this particular discussion yesterday, this was at the level of the president. And of course, the president herself, she chooses who she wants to have in her dialogue. But we do meet, of course, a lot of scientists, and we do listen very carefully to the scientific opinion. And in fact, a lot of the European regulatory apparatus still is, thankfully, scientifically driven. Even if in the end the decisions are political decisions, of course, in the last step.
Great. There's a question here. Yeah.
Yes. My name is Teresa Schell, and I work at ChemSec, an environmental NGO. And my question is also actually mainly addressed to Paul. And I want to connect back to what was said this morning, where the scientists were agreeing that there were two main aspects. And one was what we just talked about, the mixture issue that there needs to be a mixture assessment factor. And the other is that all these effects are interrelated, that you can't just look at the ovaries, but you have to look at also the neurological effects, the immunotox, for instance. And that it cannot all be up to people to protect themselves from this. Legislators need to do something. And the Commission were very strong in their chemical strategy for sustainability, promising a lot of things. And Paul, you mentioned a few already. And I want to come back to when you mentioned the GRA, the generic risk approach, where you said that EDCs would be included in that. But I also want to extend the question asking what will happen to the equally important other groups of chemicals, for instance, the mobile substances or the immunotox and neurotox that were also promised to be in the generic risk approach. Will they still be included in that? Some clarity would be great. And also hear what is actually happening with the MUF inclusion into REACH. Thank you very much.
Yeah, thank you. Can the online send the answer? Yeah.
Okay. You want me to come in now on that one? Yeah, look,
this is more for the Commission, yes.
Yeah. Look, okay, so from our side, I mean, I think it's also the Parliament will have their role to play, luckily, as it goes to the next step. But look, we of course we understand all of this, and we have been trying to make the case for having an adequate modernization which covers enough stuff. I mean, there is a lot of pushback. You know, I won't hide it from you. There are people who say, for example, on the MAF, there are various industry groups going around saying that this is not scientific. The Mixture Assessment Forum, you know, it's just plucked out of the air. They don't know whether the number should be, you know, 3 or 5 or whatever. And they are saying the whole thing is kind of not scientific. Now, from my point of view, what would be not scientific would be to pretend that the current REACH, looking at one substance at a time, adequately addresses mixtures. But you know that impacts, that pushback from industry does have a big impact, of course, in the end. And I mean, I think, you know, this is a key thing is that, of course, in the end, it's a political decision. You know, the politicians, they will need to decide, find this balance between the level of protection of human health and the environment and competitiveness. And this is, so it will be taken way above my level. I shouldn't make too many promises, obviously. So that's the mixture. And then, of course, in the GRA, yeah, I mean, indeed, we've been trying to explain to our hierarchy and also to the industry in a way that, you know, a GRA is a form of simplification. It enables you to act relatively efficiently and quickly on substances that we know are a problem. So we've been arguing that, you know, this is also a response to the call for simplification. But again, the industry line is no, this is not the simplification that we want. You know, it's not what we want to hear. So they are not very enthusiastic about that. And those decisions, of course, will be taken at the end of the year. And that enables me to address as well. One of the questions in the Q&A is, yes, we are very much working towards being ready for the end of the year. And maybe just while I've got the floor, I just want to say one last thing about the PFAS is that I didn't speak too much about it in my intervention because I didn't want to just, you know, a lot of these conferences are about PFAS at the moment. Of course, there are other endocrine disruptors, but there is a lot happening. You know, the universal PFAS restriction is moving ahead. The Commission is getting ready to act, particularly on the consumer aspects of PFAS, but also on you know, the other uses, because there are lots of other emissions. And so that is going, and we are also aware of this problem that I think the colleague who'd been exposed to PFAS addressed, which is the PFAS in the environment will not simply disappear, even when, assuming we have a good restriction, it will still not simply disappear. So we also need to think about our approach to remediation and cleanup and monitoring. And this is also, one of the scientists presented this because this is not adequately done across the EU as a whole at the moment. There are some areas where there is quite a good amount of monitoring and cleanup, and there are other areas where absolutely nothing is happening. But that for sure does not mean that there is PFAS. So we are also very conscious on this one and hoping to act.
Yes, Martin?
If we can come in, where to start? Simplification. Yes, the concern that I honestly have that the simplification might be translated as simply keep using the hazardous chemical. And the simplest way to do. It's like you just don't care. You don't test, you don't look at it, simply you pretend that the problem doesn't exist. And I think this is a really important call from me to you is please in the next months before it comes out, but also after it comes out, if it comes out, I believe the Commission proposals only when I see them on the table, is keep on raising your voice. Keep on raising your voice about the very serious impacts that the endocrine disrupting chemicals already have on our health. If you add numbers also about kind of the financial impact that in the current climate can help, because honestly, you know, without population, there is no competitiveness to start with. So this is, I think, one really important aspect. Yes, it's good to have the scientific papers and evidence on how the generic risk assessment works and all the really thick studies, which I'm sometimes jokingly saying are really good, just, you know, to bang on the table to show like these thick studies say something. But it's really important to have also and to work on the very clear language around how these things are supposed to work. And yes, also the, you know, human stories are at the end of the day also something which going directly to the politicians, you know. You don't need NGOs to call on to lobby. I'm lobbying you to really also bring the stories, very personal human stories. It was really great to hear it today, back to the politicians. And not only to the politicians in the European Parliament, but also within their constituencies. So we all feel the bottom-up pressure, because this is ultimately what is really, really important. And hearing about the PFAS contamination example, I'll tell you a different example, which is for me something showing the extent of the problems we face in Europe. Because I've been dealing with the contaminated sites since early 2000s. And there is a special area in Slovakia, in the east, in the area where, you know, PCBs, remember PCBs, polychlorinated biphenyls, you know, they were actually banned a long time ago. They were produced there until '84. And the area is still highly contaminated. There are still drums that are buried in the forest that are leaking. The people, the local population of tens of thousands of people has been used as, you know, living laboratory of a long-term impact of PCBs on human health. It's such a crazy thing that it's still happening, still hasn't been, you know, even the worst parts cleaned up. That I'm actually working with the legal experts and with the doctors on the ground on basically we found a way how people can actually sue the state. And we're trying to get them together now to do exactly that for the gross negligence that they've been living for the past 40 years, more than 40 years. In simply highly contaminated area where they cannot either produce, where, you know, the not just the health, down to, you know, the value of your real estate. So it has really multiple impacts. And yes, we face contaminated sites around the Europe. And the worst thing is...
Time is running, so
yes,
we need to also have a lot of questions in the room. We can talk about this.
It's the public who ends up paying both the impact and financially for cleanup, not the police.
Thank you. There was a question here, so can we? I think we take some quick questions and then answer the panel. So we have your question first, and then yours.
Yeah, I'm David Christensen here from Copenhagen. I've been working with Anne-Maria and Tina Kold for many years on endocrine disruptors. So this is actually, again, a question for the guys online. So seldom you have the possibility to connect with Brussels. So So there was a paper a couple of years ago coming out that if you look throughout Europe, throughout the world, there's only 2 places not contaminated with pharmaceuticals, the compounds that we are using every day in our household, and that was Iceland and then deep into the Amazon rainforest. And we are here in Copenhagen been working on some of these pharmaceuticals also, and know that all of us are exposed to compounds like paracetamol that Terje also mentioned. So I just wanted to ask if this is something that you are taking seriously also in Brussels, that these compounds that we have been using for more than 100 years are now circling back and are also like bona fide endocrine disruptors, and they are not getting broken down in our environment. We know like metformin is also there in our drinking water. We got pharmaceuticals in our drinking water here in Copenhagen also, and I think the same is true also in France and many other places. So just a question for you. I don't know if it's something you are considering already or it's something you have been discussing.
Thank you. And can we have while you're thinking about that answer, we have your questions as well, or comment?
Yeah, I wanted to come back to our spokesman.
Yeah.
I think the
and please present yourself as well.
No, sorry, you're
not everyone knows who you are.
No. So wanted to come back to your point, and I think it is really, as was already mentioned, stigmatization of victims. So what did we learn from the fallout of Hiroshima? What did we learn from Minamata? We learned that these populations were kind of getting isolated, as you described, but contrasting that now with the PFAS map we have seen, at least PFAS map for Western Europe, I think, how serious then do we take what the chemical strategy writes in terms of plants, what to do, what to reduce, and we still do not take serious that endocrine disrupting compounds are substances of very high concerns, like carcinogens, mutagens, and genocidal material. So what to the panel, I think here are some scientists, how can we really elevate the regulation and handling of endocrine disruptors to the same level what we have learned and used and are used to for all the other substances of high concern? Who has a good answer?
Yes, great. I think the online attendees, can you quick answer the first question maybe, and then and we can have the rest of the panel included as well?
I'll start on that one. Yes and no. The pharmaceuticals are explicitly excluded from the REACH scope. And in the recent revision of the water framework, I think it was, it's been really, really sensitive. It's still going on a fight where there is a very heavy lobby from the pharmaceutical industry, including one Danish giant, since you are in Denmark, against having extended producer responsibility. So against the fact that they would be responsible, financially responsible for cleaning up the wastewater from the very pharmaceuticals they produce. So that's the situation. Doesn't look good.
Yeah, no, that's absolutely true. And of course, the same companies also took the commission to court on these provisions. So maybe just to give the audience, the room, the full flavor is in the Urban Wastewater Treatment Directive. Indeed, is the idea that pharmaceutical companies would contribute to the cleanup costs. This has not made them very happy, and so we are defending it both politically and legally over the next. We will see what the final outcome will be. On that one.
Yeah, great. Yes, the panel here on both questions, if you want. Yes, start with you, Joëlle.
Yes, I wanted to answer to Josef, maybe not so satisfactory, but yes, we are scientists, but I think for this question, we are the wrong scientists. Because I think it's a very important point. We should actually take these few positive examples, genotoxicity, how did it get there? And I think we have colleagues on the social science side who could do this analysis. What went right for these categories? What can we learn from these processes to make our case stronger and faster? That's my answer.
And Karin?
Yeah, Sorry. There was no question specifically for me, but also just a comment down here. You ask, shouldn't there be scientists in the decision making? I said yes, always, and we really need that in politics in general, because I also think that the industry plays much too big a role, because it's like the arguments about wealth of the society. It's just stronger than what the scientist says. So of course they should always be there. And I think the point about, I loved your presentation about, well, being very specific about what could we do for pregnant women. They need to know, and that's also a way to change society and make the politicians more aware about the problem. I think we should start this kind of, well, it should be normal for all pregnant women to have this kind of introduction, because usually when it comes from well, the population, everybody will be aware, and that's also why how politics works. When there's a pressure from down saying, we will not accept this, then the politicians will do something. So I think this is a really good start.
Yeah.
Yes.
I just wanted to add, yeah, the education and spreading the word about the importance and about the risk among the general population, about the healthcare professionals, it kind of makes other people prioritize this problem. And also I will add something which is not my idea. This is something from the Lancet Syria that was published a couple of years ago. So they proposed some sort of an agency that would be very similar to the International Agency for Cancer Research. And this agency should deal with endocrine disrupting chemicals only. So maybe this would also be a good way to prioritize this type of chemicals.
And there's a question here, comment.
Anna-Marie Andersen from Rigshospitalet, and I'm also leader of Center of Endocrine Disrupting Chemicals. And I also have a question for you, Karin, because you mentioned that Denmark have been strong on bringing the issue of endocrine disruptors on the table to the EU. And my question is, what will you do as a politician in Denmark to make sure that we keep being strong? Because this is a way, even though we are a small country, each member country can put forward proposals, but it needs to be science-based proposals. And if we have a strong agency, strong ministry, they can make good proposals, so we can still be strong. So how would you as a politician support that?
Okay.
Well, actually, that's one of the things I can do. Actually, I can ask someone like you to write a clear scientific, questions for me that I can push on to the minister, and which minister it should be. It depends on the question. It might be the environmental minister or the EU minister, but having it written clearly and saying we need an answer to that. We need, a short description of what is the big problem and do we have any ideas about how to solve it? Then we can push it, and that's the best way to do it. And also what we can do is to have these debates in the parliament, making everybody aware, also the journalists, that we have a problem, and then pushing it on. And as I said before, I don't think you'll find any minister who would say that it's not important. They don't really know what to do, and I think they would be so happy to get these inputs from you. Written short and easy, understandable, and saying this is what you should do, and we're ready to support you. And I know they also already use some of you for that purpose, but it could be even stronger.
Time is running. I will pose a few questions from the online audience here. Caroline Hasselmann asked if so, as a pediatrician, can we contribute to research by looking for PFAS in those kids who are sick 30 times a year? Could they do that as a pediatrician? Is anyone? Yeah? No? Maybe that's just an open question, yeah.
Yes, and for sure I cannot answer that because I'm a politician, but I would say sometimes it's just, we all say science is missing, but we have so much evidence that we have a big problem. So sometimes it seems like waste of time looking into even more evidence that we have a big problem. Instead, I think we should invest much more in research, going the other way around, starting another place, saying how can we avoid this in the future, even though, of course, data is always good, but we have to use it right.
And Kenneth, before you answer, there's also a question about where did that PFAS come from? And it was the firefighter foam, right? Answer please. Yes.
So answer that question first. On the picture behind me at my presentation, the fire site was up to the right, and the fields where our cows went grazing was down below. So it was. We did know that there was a ditch with rainwater coming from the fire site, but we didn't know anything about PFAS, as you imagine. Back to the last question, and I just lost it. The problem is we can't cure infants with high levels of PFAS. We need to get a step back. The scientific project I was in, where they concluded we can't clean out PFAS in the body of humans, should be prior to that. So if you have a suspicion of contamination of PFAS, why not in advance give them the medication to get the PFAS out? If you don't take the blood sample on the mothers to be, you don't know how big impact it has. But we all have it, and even a small increase of PFAS has an effect on the children. So why don't we give them, if they have a suspicion, prior to getting pregnant, so it's not out of their bodies, so they can't pass it through milk and birth.
And an additional question for that, actually for you, it says in the studies, how do you measure how much PFAS women are exposed to in pregnancy? Can you?
Yeah, we measured it in serum in the pregnant women, so we know how much they're exposed to, and this has been a really sort of a big discussion point between researchers and also an argument between me and Philippe Grandjean, because I don't think we should measure it in all pregnant women because there's so much else to be worried about. And our pregnant women in the cohort, they were not high exposed like Kenneth's, but we said to them, you will not be informed of your results. We measured phthalates and parabens and PFAS and everything, but we thought, oh, there's so much else to be worried about. And when they get the results saying, oh, your phthalate is that, is that high? Am I passing this on to my child? And is this dangerous for my child? And we don't know. And what happened with the grazing community in the Korsør was actually that when we measured it, and I think we should measure it if you're exposed like you and we think you're exposed, then we should definitely measure it. But when we measured it, we didn't know. That's why we had money from the Danish National Board of Health, because we don't know what is the average level in the Danish population. We don't know. So we had to we had a COVID study with PFAS from 2020, and we took the highest 5% and said that must be the upper limit, but we didn't know. So, and I agree with Kenneth. One of my favorite stories is one of the ladies, and she was in that study where we used cholestyramine to reduce their PFAS, and her PFAS was 197, her PFOS. And when after 12 weeks of treatment, it was 37. And that's a good story, isn't it? Because it is much safer for her to become pregnant. But you should be high exposed because there's also a lot of side effects. And we really don't know that even if you reduce your PFAS by treatment, you don't know whether you're going to reduce your risk. We don't know that. And then another thing I think which is important, as you said, I'm part of this big initiative, which is a center for PFAS exposure in Denmark from the Danish Environmental Agency. And there is a lot of research from all over different areas in Denmark. And I really enjoy going there because they know a lot of things on soil and water and crops and everything and cows. And I think we have to work together. And I also think that in there's not a lot of health research because we can keep on showing that it's dangerous to health, but how do we reduce exposure and how do we substitute these chemicals by others? So lots of the research is all money paid into reducing exposure and finding out where the exposure is.
Thank you. That was a very good concluding remark, actually. And also we have already eaten a lot of the break for lunch, so we have to stop now. But thank you so much for the panel also to be here today, and thank for the speaker in general and the audience both here and online with all the interesting questions, and for your time to spend here in Denmark today. I hope we are all leaving with some food for thoughts, and I do invite you to reach out to the organizers of the event in case you have further questions or comments following the event today. And I will not go through all my takeaway messages, because I think we have been through them a lot today. We have to do more, we have to inform more and do more research on this. For members of the press here today, please note that at 13:30 we will have an in-person virtual Q&A with the selection of our speakers today. And most of the speakers will also be available for a quick interview if you already did that. So note that the recording of the event will soon be available online for all to see. And please, again, do engage in the hashtag because hormones matters. So yeah, thank you so much for your attention today. And now there's lunch.